Hello, I am going to do my infection control PPE video. So the first thing that I'm going to do is check my orders, gather my equipment. So I've got my gown, my mask and my gloves, and my makeshift eyewear. Then I am going to wash my hands. And then I am going to start putting on my equipment. So the first thing I'm going to put on is my gown. And when I put the sleeves on, I want to make sure that the cuffs here are kind of over my wrist. That'll help with our gloves later on. Then I am going to take the top two ties and get my hair out of the way. Tie the back tie. And then for the middle section, you want to kind of overlap your two sides as best as possible. And then string around your ties so that you're minimizing the exposure of your clothing as well. And then you just tie it up there. So now that that is on, next thing I'm going to do is put my mask on. So I am going to loop it around my head, make sure I have my mouth and my nose covered. And then I'm going to press this down so that it is tight against my nose. I'm going to put my eyewear on. And ideally, these will go over your mask. Next, I'm going to put on my gloves. So when putting on your gloves, you want to ensure that you are covering the cuff of your gown so that your wrist is not exposed at all. So just like that. Same thing with the other hand. Now that these are both on and completely covering my gown, I am ready to enter my patient's room. So then I would continue with my pre-procedure steps, introduce myself, get two identifiers, explain the procedure, the duration, and raise the bed, perform my procedure, whatever I'm in there to perform. I would exit the patient's room, and then I would start disposing of my PPE. So I would start with my gloves, and I am going to pull the glove away from me, ensuring that I'm not touching my skin in the process. So as I pull this away, I'm going to crumple it in my gloved hand. With one finger, I'm going to, on the inside of the glove, begin pulling away from me. All the while not touching my hand or the outside of the glove. So now the gloves are off, and I would dispose of these in my trash can. Next, I'm going to remove my eyewear. So ideally, my goggles would have a strap, so I would just lightly pull like this on the back of my goggles and lift it over my head and get them off. Our mask is always last. So next I'm going to do my gown. So I am going to, I'm pretty sure I just knotted it. Oh God. So So I have a knot in mine, so don't do that. So I'm just gonna break it so that I can get it off. And you're wanting to minimize your touching of your PPE. So now that it's off, you're going to grab on the inside behind, and you're just gradually pulling away and touching the inside. So you're pulling away. Now that it's away from you, you're gonna roll it up. You don't want to shake it or throw it around anywhere. And then you're gonna dispose of this in your linen hamper. The last thing you're gonna do is take off your mask by just grabbing the side of the string from behind your ear, pulling away, not touching the outside of the mask, and then you're going to dispose of that as well. Then you're going, prior to leaving the room, you should have done your pre-procedure. I should have done my pre-procedure step. So asked if she needed anything, given her a call, given the patient the call light, etc. And then after my PPE is all off, I'm going to wash my hands and do hand hygiene again. So that would complete the putting on and the removal of the PPE process. One thing I forgot to mention is you're not going to keep your same pair of gloves on generally throughout the duration of your time with your patient, because if you are passing meds, if you are touching the infected area or coming in contact with the infected area, if you're handling food, you're going to have to change your gloves after each of those occasions. So it's important to note that after you take your gloves off, the way that I showed you, you need to perform hand hygiene in between those steps as well. So that would complete your PPE process. I think that's it. Thanks.